Hello everyone, welcome to the 10th episode of Let's Talk Health. Today we have Dr. Ashok Raju Gottamukkula Garu joining us in giving his insights on hip fractures. Sir has got a vast experience of 20 years in orthopedics. He is also his expertise in robotic replacement surgeries, hip joint surgeries, pelvic and acetabulum surgeries, revision surgeries, and also in treating complex hip fractures. Hello, sir. Welcome to the session.
Good evening to everybody. Namaste. And thank you for inviting me for this small talk.
It's our privilege to have you in the session, sir. So today we want to know one of the most common conditions that we see in the elderly patients, hip fractures. So can you please let us know what is a hip fracture and why should one be worried about having a hip fracture in their old age?
Yeah. So I think the topic we are going to talk about is hip fractures in elderly people. Why do we need to know about it? As we become old, what happens is our bone strength comes down. That is called as osteoporosis. And because of many other medical issues, our gait pattern might also change. These two combined procedures or these two combined parameters lead us to a trivial fall. And this trivial fall causes most of the time fracture at the hip joint, which is a ball and socket joint. The lifespan of a human being has increased because of the advances in the medical field. But with the increase in lifespan, there's a decrease in the quality of the bone and it is more pronounced in the hip joint. So any trivial fall will create a fracture of the hip joint.
Sir, how can we know that a person has sustained a hip fracture?
With the trivial fall, patient has severe pain in the hip joint and sometimes hears a pop sound in the hip and is unable to get up independently. These are some of the features which tell us that the patient has a hip fracture.
Yes, sir. Sir, can you also let us know what are the treatment options available for an elderly patient with a hip fracture?
The treatment options most of the time is surgical treatment. There are different modalities of treatment based on where the fracture is happening. There are different parts of a hip joint. If they are happening at the ball part, then we do a replacement of that part. Either we do a hemi replacement, that is we just change the ball part of it, which is called as a hemi replacement, or in some individuals who are very active, we change both the cup as well as the ball, which is called as a total hip replacement. But in some fractures where there is a fracture not involving the ball part of it, then we need to fix these fractures with plate and screws or a nail and screw. If the fracture happens at the level of the trochanter, there is a part called as a trochanter, these fractures need to be fixed with either plate and screws or nail and screws.
Sir, isn't it risky to perform surgeries in the elderly patients post-hip fracture?
Yes, it is a risk to operate such elderly patients. But we have to mobilize these patients as early as possible. So the best option for us is surgical treatment. Why are we doing surgery? One, to reduce pain. Second, to mobilize the patient as early as possible. By mobilizing the patient, his other comorbid conditions like diabetes, hypertension can be got into control. And we are likely to get back these patients to the pre-injury status. These patients are evaluated very well. We get all the departments, different departments. It's more of a teamwork what we do. We involve the medical treatment, we involve the anesthetist, we involve the critical care people, and we perform the surgery. and the surgery is done with all the latest advancements at our side. So surgery is a good option because they are pain free and we can make them mobile as early as possible. The risk is only during the surgical period. Most of these patients are assessed for the medical risk and all the precautions are taken during the surgical time.
Yes. So, how is the process of recovery in the patients post hip fracture surgeries? And do they require any lifelong assistance or can they be independent?
As soon as the surgery is done, the patients are very happy because the fracture pain disappears. And once they settle down post surgery, we make them mobile or make them walk as early as possible. That is, 1 day after surgery or 2 days after surgery, based on the medical conditions of the patients. So these patients are pretty independent by end of 1 week. Yes, they need to take precautions. They have to change things at their home, like they cannot sit down, they have to sit at a high chair, they have to make modifications in their washrooms, they have to make modifications in their bedrooms so that one, it becomes easy for them in their daily activities, and at the same time to avoid further falls.
Sir, what are the lifestyle modifications that the elderly patients should adopt so as to avoid hip fractures and any further injuries?
There are two aspects of prevention. One, to increase the quality of your bone. So one is by taking medication so that your calcium in your bone is increased as prescribed by your doctor. Second, having a well balanced diet. And three is by regular exercises. The other aspect of prevention is lifestyle modification. As you become elderly, I think your gait pattern changes. You need more support to prevent you from falling. So there should not be any hesitation in using measures like using a walking stick. Second, change your flooring into an anti-skid flooring in your home, or have rails around your washroom so that you take their support and avoid falls. These are some of the measures you can take, and one should not shy away from using a help.
Thank you, sir. Thank you for your valuable insight on giving us knowledge on how to prevent hip fractures in the elderly.
Yeah.
Thank you, everyone.
Thank you.
Let us meet in the next episode. Please do reach out to us with your queries by commenting in the comment section. Thank you for watching our live session. Let us catch up with an interesting topic in our next episode. Please do reach out to us with any of your queries through our comment section. Thank you.